Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One condition we treat in our office is called Bell's palsy. So Bell's palsy is a sudden weakness on the muscles on one half of your face. So what will happen is one half of your face will kind of droop down. So it'll be difficult to smile or make any facial expressions. And it's a very strange condition where only one half is affected. This is often caused by a virus, so any kind of common virus, and it's idiopathic, meaning they don't know often what triggers it, but a lot of times it's a virus that is the main cause of it. And this can last from days to weeks. There are some cases where it turns into a chronic condition, and that is something I treat in my office as well, but the most common that patients come in with is they have an acute Bell's palsy. So in this video, I'm going to show you how we perform acupuncture for Bell's palsy. So to treat Bell's palsy, we're going to perform acupuncture on her face. So what we're going to do is we're going to place tiny thin needles into certain points along her face. These are very tiny, they're about the thickness of a hair, barely even feel them when we put them in. And what we do is we put them in and we leave them in for 15 to 20 minutes and then we take them out. And so what this is going to do, it's going to help to stimulate those points to help fix some of the facial expression issues that they're dealing with. So what it's going to look like is we're going to place one of the acupuncture needles here. And what she feels is just a little gentle tap. These are, again, really tiny needles. You barely even feel them once we put them in. And we're going to do one, say her mouth is drooping a little bit. We're going to do one right to the side of the lips. Good. The next spot we're going to treat is more for the eyes, so it's going to be right here. And then the next acupuncture spot is right up here. How would you describe what this feels like where I've placed the acupuncture needles?
It's not painful at all. I do feel you tapping.
Yeah, and that's what the patient's going to feel. It's just a little tap, and that's us inserting the needle. But beyond that, it's very pain-free. And then, depending on what her condition is, we will place certain needles in different spots. So say, again, she had an eye issue or she had inability to open or close her eyelids. So we're going to place one right here. Good. Then that is a typical Bell's palsy treatment for the face. Now, the other thing we're going to do is we're going to place a couple acupuncture needles on certain spots along her forearm and hand. And again, those points kind of correlate with some of the areas we're treating up here. So what we're going to do is we're going to place an acupuncture needle right in this spot. This is called large intestine 4. It's a very important point for any kind of head or face conditions. And the other one, sometimes we're going to treat, is going to be on the wrist. Okay, perfect. So that's a common treatment that we'll do for Bell's palsy. Again, the needles will be left in for about 15 to 20 minutes and then we'll take them out. And we can perform this treatment several times throughout the week to help fix the condition. Sometimes Bell's palsy also turns into a chronic condition. And there's a few patients that I have that have this. And a lot of times the patients will go 3 or 4 weeks and then what they'll start to feel is that drooping feeling start to come back. And a lot of times this is exacerbated by stress or tension. So acupuncture is a great treatment to help keep the symptoms at bay. And again, it depends on the patient. Some will go several months before they need a treatment and some, will have to come in every 3 to 4 weeks. But again, a lot of that is going to dictate by how much stress you have in your life and what's going on in that area. But the most common thing we see is those acute conditions. And again, we often speed up that recovery and get the patient feeling better in days or maybe a week, as opposed to if they leave it alone, it'll just commonly resolve in several weeks. So if you're suffering from Bell's palsy, give our office a call at 703-912-7822, or you can schedule online at novacarewellness.com.